Welcome to So Everyone Can, our new podcast presented by Heartland Family Service. I'm your host, Mitch McCartney, and in a moment, I'll introduce you to our So Everyone Can podcast team. But first, a brief explanation of what we hope we'll be able to do during our time together. This podcast, So Everyone Can, is intended to do a couple of things. We hope you'll leave each episode knowing a little more about our organization's efforts to empower others to overcome the obstacles in their lives, whether that be mental health challenges, the stability of having a place to live, dealing with substance use or problem gambling, or the threat of domestic violence and abuse. But we hope you'll also leave each episode feeling a little more empowered yourself. It's a complex and challenging world we live in today, and if the conversations we have and information we offer here help you in your daily journey in some way, well, then it was worth our time to bring it to you so everyone can. If you don't know who Heartland Family Service is, you're going to learn a lot more about us on today's program. We'll be talking to Jeanetta, the president and CEO of Heartland Family Service, for this inaugural episode of the show. HFS has been around in Omaha, Nebraska and the surrounding area since 1875. The work HFS does is largely centered around providing professional, caring, and compassionate social work services to the most vulnerable members of our communities. We'll talk with John about the mission of HFS, the need for organizations like HFS in the community, and what he sees as the community's needs of the future. So with that, let me turn to my friends and colleagues who are a huge part of what we do at HFS and who will be part of the So Everyone Can team. Kelia Guevara, our Diversity, Equity, and Inclusion Officer at HFS, is going to be on our show. Kelia, I'm thrilled to be working with you.
Thanks, Mitch. I am thrilled to be here with you as well.
So Kelia, tell me a little bit about what you think maybe you hope people will be able to get out of So Everyone Can.
I hope that people will come away with some enjoyment from listening to meaningful stories. I hope that they will get a sense of the diversity of voices and experience from our employees and the different programs that we do. And I hope that they will have a deeper understanding of our culture and the way that we work at HFS, because I think that it's pretty powerful and pretty unique in our area.
It is. I think that one of the things that I really enjoy about HFS, just as a person who is a part of the organization, is that culture that you talked about. It is so affirming. And I think it's affirming because that's the way we approach everything that we do. We approach that with our, take that same approach with our clients and those that we work with. So I absolutely agree. Thanks for being a part of this show, Kelia.
Thanks for the invitation.
Tanner Downs is also a member of our team. Tanner is Community Relations Coordinator for HFS. Tanner, welcome.
Thank you. Thank you so much. I'm so glad to be here.
Tanner, what are you hoping to get out of this experience?
I am hoping for the community, for the listeners to hear about Heartland Family Service in a way that they aren't able to otherwise, whether that be a video or an email blast. This is, I think, a great way for people to see another side of Heartland Family Service. I've always enjoyed learning about things in more of a conversational tone and seeing different perspectives. And I think this is going to be a great platform for both of those things to occur. I'm very excited about it.
Great. Well, I'm excited about this team. Kelia is going to be doing a lot of our interviews. Tanner is going to be our organizational guru who's going to keep Kelia and I straight as we try to put this podcast together once a month and bring it to you. So thanks to both of you for being a part of the team and willing to take a leap of faith on this venture. So with that, we're going to take a short break and give you a short message. And then after that, we're going to come back and Kelia is going to talk to Jeanetta, President and CEO of Heartland Family Service. We'll be right back.
Hello, I'm Tanner Downs. Feeling good and looking to spread the joy? Well, you are in luck. Do Good Week is right around the corner, April 19th to the 23rd. Do Good Week is brand new. Do Good Week is a week-long celebration of philanthropy and giving coordinated by our friends at Share Omaha. From financial giving to volunteering and wish lists to recruiting new supporters, Do Good Week is giving hundreds of nonprofit organizations throughout the Omaha and Council Bluffs metro area the opportunity to connect with people who care about the community. At Heartland Family Service, we are extremely proud to be participating in Do Good Week. We would be thrilled to have you connect with us by going to shareomaha.org and searching for Heartland Family Service. If you wish to donate, click the donate button on that page and make sure to enter the donation code Do Good Week. That's all one word. Every gift, big or small, allows Heartland Family Service to continue to provide services to those most in need, so everyone can. So this week, let's all do something good for those supported by our Omaha and Council Bluffs area nonprofits. Support Do Good Week.
Welcome back, everybody. We are here now with Jeanetta, our president and CEO at HFS. Welcome, John.
Hello, thank you. Glad to be here.
Thanks for joining us on our inaugural podcast episode of So Everyone Can. This episode is focused on understanding our mission. So we are really curious your thoughts on what is the mission of HFS? What are we all about?
Well, our mission is, as it's written, to strengthen individuals and families through education, counseling, and support services. So basically, we take three sort of distinct but related activities: counseling, support services or case management, and then education, and braid those together in different ways to meet the needs of different populations. So sometimes you'll look at, if you go to our website and look at all the different things we do, it'll be like, wow, you do so many things. But really, we're just doing those three things in different iterations and different combinations, different levels of depth to meet the needs of people where they are.
That's a really beautiful story because I can see that almost visually happening. And do you want to share anything about that multi-service approach and what we've learned about how that approach seems to work with our clients and in our community?
Yeah, it's rooted in our DNA because we've been multi-service since the day we began in 1875. And I don't know that we necessarily knew what we were doing back then. I think we started off as a multi-service organization just because there wasn't anybody really in this space. I mean, it wasn't until the 1960s and the war on poverty that the nonprofit social service sort of field really developed. Previous to that, it was churches and faith communities and synagogues and what have you that just through voluntary efforts tried to create responses to issues like poverty and child abuse and all the things that we addressed. And so in those early days, without a very robust, system in place to sort of organize and fund those activities, our friendly visitors, which were our initial volunteers, as they were going out and meeting with individuals and families and identifying needs and not really having anywhere to plug them into, created, solutions. And so over time, we started with, works programs where we had a wood yard and a laundromat and a soup kitchen and all these things. And then that evolved into, counseling services and an orphanage at one point, and jobs, I already said jobs programs, remedial loans. I mean, wherever there were needs, and if there wasn't something out there, we started it up. But I think then as we evolved and became professionalized, we started to see that oftentimes it made sense to have some programs offered together under one umbrella because they can leverage each other, and it's easier to make referrals and it's easier to plug in and meet people where they are when they need those things at wherever they are in their journey. So now we know that based on some longitudinal work that we're doing, that many of our clients, they might come here for one thing, but it's very, very often that they're then attaching to two or three other things as those needs emerge and they and their counselor or educator or case manager see the need for other activities or interventions. I mean, it's always driven by the client as much as possible. And so as the client's identifying what they want to do, then we're just trying to figure out, okay, where do we help you? And we don't limit it just to what HFS does. We have over 100 partnerships across the community to do similar sorts of things.
Which is fantastic. Very client oriented, and letting the client lead, almost like the care plan, and finding those connections when they're needed. Why do you think that companies like ours are so necessary?
Well, I think that we know that we're only as strong as sort of, our weakest link, right? As a community, I think the Amanda Gorman, the poet laureate at the most recent presidential inauguration, her book was published today, and she said, we climb the hill together. I mean, we don't get up the hill unless we're all climbing up the hill together. That's what serves our country best. That's what serves our community best. And so I think organizations like ours, nonprofit, human serving organizations, that's what we exist to do, is to focus on those parts of our community where the suffering is happening, where needs aren't being met, and figuring out how to address that to give people the opportunity so everyone can, right? Because it's not the work, for-profit companies can't do this work. There's no money to be made, and that's why for-profit companies exist, and government can't do it. They don't have the expertise. So that's where we fit in.
I love that image of us all getting up the hill together, and we truly do all belong to each other. And when everyone is cared for, the whole community becomes stronger, healthier, a happier place to be. Thinking about that, and that we've been in a pandemic now for, we've celebrated our 1-year anniversary of Heartland shifting most of our positions that could went home, and we have been doing telehealth, and we've been meeting clients virtually. Of course, our residential programs never closed, so we have had people direct care face to face this entire time. What do you see as some of the needs coming up on the horizon as we hopefully see the detrimental effects of the COVID virus tamping down, and the health and well-being of our community ramping up? What do you see as some of those needs coming up for us?
Well, I think what other disasters have taught us is that it's after the disaster that we start to see the real acute mental health needs that have emerged because of the disaster. So we already know that. And depression and anxiety are at the highest levels. I mean, I think it used to be like something like 1 in 10 people, and now it's 1 in 3 experience those issues. And so again, if the past is any guide, we know that as this disaster abates, there's going to be a lot of people who are still reeling from the psychological and traumatic aspects of living through that. And they're going to need help and support, especially people who lost loved ones, lost multiple loved ones, lost employment, lost their houses. I mean, a lot of stuff happened to people during this time. Some of us were really lucky, and for us, it was mostly being confined to working in a place we don't normally work, and not being able to go to restaurants and movies and hang out with family and stuff like that. But for other people, it was pure devastation, and other people, it was somewhere in between, right? And so a huge need is going to be addressing those unmet mental health needs that will continue to evolve. And then the other, I think, is housing, because we know that thanks to the Centers for Disease Control and federal government intervention, and even at the state and local levels, there have been moratoria on evictions. But eventually those landlords need to get paid, because that's their livelihood. And if the people living in their houses and apartment buildings can't pay, eventually when those eviction moratoria end, they're going to be evicted. And what's going to happen to all those families and individuals? And so I think that's another thing that we need to be watching closely, and we will be called forth and called up to respond, because that's a big part of what we do.
What would you like the community to know about how to support Heartland and other service agencies like ours as we try to rise up to meet this new level of need, specifically with mental health and with housing and with just real devastating loss that our community members have experienced.
Well, first, I'd say asking for help isn't weakness, it's strength. So if you need help, don't be afraid to reach out and ask for it. That's why we exist. We're going to be talking about mindfulness later, but it's part of mindfulness, mindful self-compassion. It's identifying that it's common humanity. Everybody needs help at some point. So if you need help, and this is especially true for people maybe who've never had to reach out and ask for help before, it can be really difficult to do it, but that's why we're here. And we don't judge. We understand why people need help. And we want to. So please reach out. It's also really difficult for a lot of people as it relates to mental health. For some reason, for a long time, there's been a huge stigma associated with mental health, that if you have mental health problems, there's something really wrong with you. It's major weakness. I think that that's changing, and maybe that'll be a sort of a silver lining into this pandemic cloud. But definitely, the sooner you can reach out, the better. The sooner that you connect with someone to help you, the better. And so I would just encourage that. Another thing I would like people to know is that there's lots of ways you can get involved in supporting our work. Obviously, of course, donating donating funds, donating in-kind goods, and donating your time are all super helpful. So if you have time, if you have resources to give, please know it will be made to good use, and we always appreciate that. And then lastly, the thing I would say is to just keep us in your thoughts and prayers. I mean, this is really hard and heavy work for a lot of the people here. And sometimes I think it comes at an expense far greater than many of us even acknowledge. So we know that the impact of COVID-19, we know what that's been on frontline healthcare workers. We've seen it. In many instances, it's been quite devastating. I think it's been, in many instances, super difficult for a lot of the people that work in organizations like ours, being overburdened with people, I mean, just overrun almost by people needing help, not having all the resources needed to help them. And for people who are motivated by wanting to help, that can be a really difficult thing to try to handle, process, while at the same time dealing with all of the loss and everything that you are going through and your family is going through throughout the pandemic. So sort of a double whammy.
It has been a double whammy of a year for sure. And I know inside of Heartland, our staff have been so dedicated and so innovative and so passionate about helping and being with their clients and trying to meet all those needs within their own parameters and within their own safety parameters. We have definitely seen the impact of that year on our staff for sure. And I'm glad that you brought that up. There's a big part of our culture with our staff around self-care and around the importance of prioritizing taking a break, taking a rest, using your PTO. And as you mentioned, we're going to talk about mindfulness. We started that project a couple years ago. And I think through the pandemic, we saw how important those really informal skills of being able to take some deep breaths, take a walk outside, had the impact that those had on our staff members who practice. So I'm really curious, and I'm sure listeners are curious about, what does mindfulness mean? What does that mean to you? And how did that get started at Heartland?
So mindfulness to me means just being present in the here and now without judgment. It's just about paying attention to what's happening and accessing information through your five senses. They're always at work anyway. The problem is most of the time we're not paying any attention to what they're telling us. So mindfulness is just slowing down and noticing what's going on and not labeling it, just describing it. So it's not good or bad, it just is. And it's in that freedom of not judging that you can really let go of a lot of stress, a lot of tension. And in that you can also find gratitude and happiness and joy, really. There's a lot of research actually that backs it up, plus a whole bunch of positive health benefits. So, and we ended up, I think there was a lot of interest in many of our staff to head this direction. From when I first started here back in 2009, I can remember therapists telling me, John, when they would talk about their vision for the future, they really wanted to see our work being whole body, not just, from a therapeutic perspective or a clinical perspective, not just talk therapy and trying to figure out what's going on in somebody's mind, but really doing full body work, which includes things like mindfulness, meditation, yoga, even massage, occupational therapy, again, the whole body, because they understand that, especially for people who've experienced trauma, that trauma resides in the whole body, not just in the brain. So that approach is needed. So when we heard about an opportunity through a local foundation, a local family specifically was wanting to make contributions to organizations, especially organizations serving children and youth, they wanted to make contributions to those organizations to fund the capacity building of staff to develop a mindfulness practice, so that eventually mindfulness could be something that would be taught to the people who make use of those organizations, children and adults. And so it was an unusual opportunity, because most often when grants are made, public or private, it's not about helping staff, it's about helping clients, which is great. But sometimes it's great to be able to help our staff too. And so this was a really attractive opportunity to get some funds in to teach our staff about mindfulness and to support them to develop a mindfulness practice, so that eventually we can offer that same wonderful opportunity to the people that we serve. And that's what's happened. So over these last couple of years, we've had all kinds of people go through training and different kinds of mindfulness practices, primarily mindful self-compassion, but others as well. We've got an employee resource group now that's comprised of employees who have a mindfulness practice and who have agreed to be ambassadors to other employees to explain what it is and to lead meditation sits and that sort of a thing. And we're starting in some of our programs to offer this to our clients as well. So it's been a really, really great thing, I think, and it will continue to be.
That's awesome. It's so exciting to have that opportunity for staff. And I think what you said in the beginning about being present without judgment and just noticing. And I think during the pandemic and everything that we have had no control over, being able to recognize I'm still breathing. I can be grateful that, the sun is shining today. Has for me been a really helpful practice. And I know I've heard from many people that was helpful for them too. Well, I just want to thank you so much for your time here today and for joining us on our first session. I want to thank you for your leadership over this last year, because I know it has been a powerful time. It's been an exhausting time, and your presence and your authenticity and the way that you have led us through it has been really impactful. So I want to thank you for that.
Thanks, Kaylee.
Yeah. And also personally, just love working for you. So we're going to take a break. And when we get back, John will be leading us in a moment of mindfulness.
Here at Heartland Family Service, we're rolling out the red carpet on Broadway for our 17th annual Strike a Chord Gala. Join us online on Friday, June 11th at 6 p.m. as we make a difference in the lives of thousands of children, individuals, and families in the Southwest Iowa community. The theme of this year's virtual Strike a Chord Gala is On Broadway, and we hope you will both be entertained and inspired. There are a number of ways you can participate in this year's gala. Beginning the week of June 7th, you can register to bid on some great silent auction items, including a couple of great travel packages. You'll also be able to donate directly. And of course, we invite you to watch the show on the night of June 11th to learn more about how your contribution helps the communities of Southwest Iowa. Individual tickets are available for purchase, which includes a dinner package from a local restaurant partner. A variety of sponsorship opportunities are also available that include ticket bundles for your group or organization. For more information on Strike a Chord, go to heartlandfamilyservice.org and click on events in the upper right-hand corner. Please join us in being a part of Strike a Chord Gala so everyone can. It will be a show to remember.
We're back on So Everyone Can, and we still have with us, we're thrilled to have with us, John Jeanetta, the president and CEO of Heartland Family Service. And as Keelia mentioned, the two of you talked a little bit about mindfulness and self-compassion as such a theme of what it is that we do at HFS and how we do what we do. So what we want to do as a gift to those of you who listen to the podcast, and we hope you will become a regular listener of this podcast, is we want to do a mindfulness moment as part of every episode that we do. We think it's important to give you an opportunity to just take a moment and kind of center yourself. And as John was saying earlier, be in the moment. And so, John, you are one of those who you talked about earlier who has been trained in mindfulness. And so we've asked John to stick around with us and do a mindfulness exercise. So I'll turn it over to John.
Yeah, thanks, Mitch. So we're going to do a meditation, which is one type of mindfulness practice. And this is just a brief one. Sometimes it can be referred to as just like almost like an arrival practice or a landing practice. So it only takes a couple minutes and you can do these throughout the day. That's one of the things I really like about mindfulness. It doesn't have to be like a half-hour meditation or an hour yoga session or anything like that. It can be 2 minutes of just breathing or paying attention to all of your senses or wherever you're touching the ground or your chair. So we're just going to do a really brief couple-minute meditation or arrival practice. So if you want to find a comfortable place, either in your chair or laying down, whatever works for you, and closing your eyes or lowering your gaze, again, whatever is most comfortable to you, and settling into your body. And starting to feel all of the places your body is touching your chair, your feet are touching the floor. Looking inward now with curiosity, just paying attention to whatever you notice. Simply feel it without any judgment. Now turning attention to your breathing and noticing the sensations of the air flowing in and out of your nose and mouth. Just normal breathing. Feeling your stomach and your chest move in and out, up and down with each breath. Following the breath with each inhale and exhale. Again, just breathing naturally. Whenever your mind wanders, coming back to your breathing. Now gently smiling within, bringing a sense of warmth and kindness. Maybe placing a hand over your heart and wishing yourself well. Being aware of the room again and your position in it. When you're ready, you can open your eyes.
Awesome. Thank you so much for doing that, John. That's, one of the things that I've really learned from participating in these mindfulness exercises, and I never realized it so much earlier in my life, is just how many times at the most anxious moments and at the most hectic moments that I look back now and realized I just wasn't breathing. And it's amazing to me. And so I catch myself even still today doing that. So it's things, this exercise is great because it kind of helps remind me to just breathe, just take a moment, breathe. So thank you so much.
Have you ever done the 4-7-8 breathing? It's something that Dr. Khan taught some of us on the leadership team as part of this program we were doing with him.
I have not.
You breathe in 4 counts, you hold your breath 7, and then you breathe out in 8. So
wow.
You breathe in pretty big on those 4 up, so you have enough to hold it for 7, and then you take your time letting it out on the 8. And you only do 4 cycles of that breathing, and it will really, like, if you're feeling stressed out, that will, like, it's like a magic. It's like, it actually changes how your heart's beating. So it's not just relaxation, but it's really sort of recalibrating your heart. And sometimes when I'm going to do a longer meditation, I'll do that first, and then I'll go into a meditation. Or even if I'm in a meeting and it's starting to get a little bit tense, I might just kind of do that on the sly, just to make sure I'm staying in a good sort of emotionally regulated place. And that's what I love about mindfulness. There's a million practices out there like that you can use that are really, really helpful in keeping you present and aware of what's happening right now.
Great. And like I said, we're going to offer a mindfulness moment on every episode of So Everyone Can. It's one of the things we think we can do as a service to those who will be listening to the show. So again, thank you so much for your generous gift of your time today, spending some time with us. We know you're a busy person, but we really appreciate it. And also just, again, as Keely mentioned earlier, for your leadership in this organization, in this community, at a time when we really find ourselves in a challenging world. So thank you so much, John.
You bet. It's an honor for me to work here and to do what I can to help our agency and our community. So thank you all.
Thank you. So that wraps up our episode for this month. We will be back with a May episode of So Everyone Can. So Everyone Can is a podcast presented by Heartland Family Service. For more information about who we are and what we do, you can find us on the web at soeveryonecan.org. If you have a need to intersect with us about our services and want more in-depth information on that, you can also go to our website at heartlandfamilyservice.org. So thank you for listening. Take care of yourself and be well.